Hi, this is a presentation on dentine bonding, how to make it last. Marriage is a sacred bond between two imperfect souls, which is made possible by God. The catchword here is two imperfect souls. The bonding in dentistry also may be similar. It may be a marriage between two imperfect surfaces, that is, your resin, that can be composite resin or your resin cement, and the tooth surface made possible by the dentist. Here also the two catchwords are there, that is the imperfect surfaces. That's why we should be very careful in both this bonding. I will be elaborating on or updating on your what you already know about dentine bonding systems, what are the recent advances, what are the recent changes in the techniques, and what can be done to improve dentine bonding. The other bonding, you got to take care of yourself. Dental bonding is a state in which two surfaces are held together by interfacial forces. It can be enamel and resin, dentine and resin, and even cement and resin. We will go into the components of bonding agents. You have three components basically. First one is your HN. Everybody know, universally accepted is 37% phosphoric acid. So other agents are there. We will leave that. Then you have the adhesives, that is basically unfilled resins. You all know the composites are filled resins, that is why they are thick and viscous. Your adhesives in your dentine bonding systems, they are unfilled resins. Then there is your primer. Primer, the role of primer is that you have the dentine that is hydrophilic, that is inherently wet, and that has to be bonded with your bonding agents, that is hydrophobic in nature. You need something as an intermediary in between these two, hydrophilic dentine and the hydrophobic bonding agent. So your primer, it has got two parts. It has got a hydrophilic end that will bond with the dentine, and it has got a hydrophobic end that will bond with the dentine adhesive. Okay, so it then the primer needs a vehicle to take it into the dentine. That's a solvent. Solvents commonly used are acetone, ethanol, or nowadays what is used is water. This promotes good penetration of the unfilled resins or adhesive resins into the hydrophilic dentine. So primer is a monomer or mixture of monomers that has got hydrophilic and hydrophobic components that are carried in a solvent, acetone, ethanol, or water to promote good penetration into the hydrophilic dentine. We will see the bonding agents in general. We all know about, we all might have heard of a generation of bonding agents. So the first three generations, that they are no more in use, so I'll leave that. From fourth generation or seventh generation, that is commonly available. You have eighth generation also, that we will see later. These bonding agents can be divided into two. They are basically H and rinse systems as well as sulfate systems. H and rinse systems are those systems in which your bonding agent or the bonding system contains a syringe that contains a blue gel, that is a syringe containing orthophosphoric acid. Okay, so your fourth generation, we have an acid in a separate syringe. You have a primer and adhesive in two separate bottles. So you have three separate bottles. You apply the acid to the prescribed time, rinse off the tooth surface with water. Maybe the prescribed time is 15 to 20 seconds. When rinsing also, what they say is you should rinse little more than the time that you have taken for etching the enamel or dentine. If you take 15 seconds for etching, you have to rinse it off 15 to 20 seconds because you don't leave any residual acid that can cause post-operative sensitivity. Then after drying the tooth, that is acid etch, you apply the primer, then you apply the adhesive. Both have to be light cured separately. So fourth generation is a three-step system, and a classic example of that is OptiBond. Okay. Then fifth generation is a two-bottle system. You have the acid in the syringe, then you have the primer and adhesive in the separate another bottle. They are together in one bottle. So apply the acid, then rinse off the acid, dry the tooth, go for primer and adhesive simultaneously. That is, it's a two-bottle system or two-step procedure. Example is prime and bond. Then came the sulfate systems. You won't find the acid separate. Acid is along with other components. Okay, so sixth generation, again you come across two bottles. Suppose a bottle, first bottle that contains acid and primer together, you call it bottle A, and the adhesive containing bottle is bottle B. Sixth generation, there are two types. One type in which you apply the as component of bottle A on the tooth surface for the maybe apply that with your applicator tip. Then you take the component from bottle B, that is your adhesive, then you apply there over that. So there is no rinsing in between. You apply one layer over the other. Wait for the prescribed time, let cure that. That is sixth generation type 1. Then there are type sixth generation itself, there is a second type wherein you take the one drop of the liquid from bottle A and take one drop of liquid from bottle B, mix this together in a mixing well outside, apply it onto the tooth surface, uh, rub with your applicator tip for the prescribed time, like you that. So that is two-step self-etching systems. Okay, that's all. So here you have two bottle systems. There is no rinsing in between. That's the advantage. Then seventh generation, you have one single bottle only. Your work is much better, easy. You have the acid, primer and adhesive in one single bottle. You apply that onto the tooth surface. Actively rub for 20 seconds or 30 seconds or even 10 seconds as prescribed manufacturer, like you other. So example of sixth generation is clear fill SE and seventh generation is prompt help off. So this is the etch and rinse systems and self-etch systems. Etch and rinse systems, you etch, rinse it off, then you do the rest of the procedure. Self-etch systems, there is no rinsing in between. So fourth generation is a 3-bottle container system. Fifth generation is 2-bottle system. Sixth generation again is a 2-bottle system, but there is no rinsing in between. Seventh generation, there is only one single step. You see the bond strength of all these components that is listed on the bottom. You can see it has got bond strength above 18 megapascal. Any dentine bond strength above 18 megapascal is supposed to be satisfactory. That's the advantage of all this currently available system. The first 3 generation does not get this bond strength of 18 megapascal. That is why they have been taken out of the shelf. Before going into bonding systems, you got to know what is wet bonding technique. Okay, wet bonding technique, because all the bonding agents that are currently available is dentine bonding systems. You see the picture on the upper right corner. Okay, you can see what you see here is the treated or etched or conditioned dentine. The when you apply the acid onto the dentine, what happens is all the organic material only will be left behind. The inorganic material will be demineralized by the acid. Okay, so only the organic material, that is collagen mesh, is left behind. The fibrils, collagen fibrils, are apart because there is water in between. So into this, when you apply your dentine bonding system, your primer has got a hydrophilic part. It will go into the wet collagen meshwork. Then when it goes in, it drags in the other end of that is hydrophobic end, that is bonded with adhesive resin. So this adhesive resin will go into the collagen meshwork. Okay, so then I told you the primer has got a vehicle, that is the solvent. The solvents are either volatile solvents or water. If it is volatile solvent like acetone or ethanol, it will evaporate off. If it is water, it will form a part of the collagen meshwork. Okay, so you see this picture. What happens is when you dry the dentine after acid treatment, the collagen meshwork will lose its water. It will collapse. The surface will become an impermeable amorphous layer of denatured collapsed collagen that cannot be penetrated by your adhesive resin. So the bonding will be a feeble bonding on the top surface alone, whereas if the collagen meshwork is wet, as you see in the right picture, the bonding agent will penetrate into the collagen meshwork, or there will be a layer of demineralized dentin that has been infiltrated by resin material. That is called hybrid layer. Okay, then so this is why we should always practice wet bonding technique with the current systems, because all the current systems available are dentin bonding systems. You won't find a separate enamel bonding system. The bottom picture shows the microscopic structure of etched dry dentin on the left side, where you can see all the fibrils are closely packed, so it won't be able to be penetrated by the adhesive resin. And the right side you get etched moist dentin, wherein you can see the fibrils are much apart because there is water in between, that can be penetrated by the primer followed by the adhesive resin. There can be effective formation of hybrid layer. So you have to follow wet bonding technique. Then the question that comes is, how wet is wet? Previously they used to say moisture should be removed by blotting or with a gentle blast of air. Okay, the then now, because we are all much used to drying with air, they allow gentle blast of air. Okay, but after gentle blast of air, the dentin should appear moist. That is, the cavity floor should be glossy. It should not be dull. If it is dull, that means the dentin has dried off. There should be no pooled water in the cavity. That is also very important. There should be no pooled water in the cavity. If the cavity is dry, rehydrate that by wiping with a wet cotton pellet or with 2% chlorhexidine. That is very important. Okay. So we will see why chlorhexidine in the later slides. So the advantages of sulfate. There is no need to acid it with phosphoric acid. You have no acid agent separately. That means there is no post conditioning rinsing needed. Then there is reduced post-operative sensitivity. Why reduce post-operative sensitivity? Suppose you are using an etch and rinse system. Okay, when you are using an etch and rinse system, what happens is the acid may have penetrated to a depth of 20 microns. When you dry the dentin and apply your bonding agent, what happens is this primer and the bonding agent might go in only 15 microns. So there will be a 5 micron of demineralized dentin with exposed collagen that has not been infiltrated by your resin material. Okay, so there can be water movement in that layer. There can be sensitivity. That's why sulfate systems are better, because there is simultaneous demineralization and resin infiltration. Okay, then because there are less steps like rinsing and drying and all is less, so there is less sensitivity to degree of wetness and dryness. There is low technique sensitivity also because the steps are less in this technique. But there are it comes with few disadvantages also. One, the strength of the acid in sulfate systems is much weaker compared to your ethanol systems. So the bonding efficacy to enamel is going to be less, because the acid may not be able to effectively etch the enamel. Then bonding the sclerotic and caries affected dentin also may be less effective. Then the third thing is there can be bond deterioration with the aging. Even though the initial bond strength is satisfactory, it can lead to premature failure. Why this bond deteriorates with aging is because your dentin bonding agent is going to bond with the collagen meshwork that is organic. It has lost its mineral protection. It will degenerate over time. So your bonding also will disintegrate or deteriorate with time. Then there are few difficulties, like there is incompatibility to chemical cure and dual cure composites. So these are the disadvantages. That is, major one is there is less effective etching of or bonding to enamel. Second one is bond strength will deteriorate with aging. Then something that came up into from 2012 that has become very much part of dentistry or dental bonding is universal bonding systems. The first product was introduced as all bond universal. It's called universal because it's universally used, applicable. Can be the universal bonding systems can be used in total edge, self-edge, and selective edge techniques. They can be used with light curing, self-curing, and dual cure resin. They can bond to all tooth substrates such as enamel, tendon, and cementum. They can be used with non-dental substrates such as indirect composites, ceramics, and even zirconia. That is, they have universal application, so they are called as universal bonding systems. All the uh, companies in bonding are definitely making universal bonding agents nowadays. So we have talked about total edge, self edge, and all in between. So we will see what is total edge, what is selective edge, and what is self edge systems. Total edge, you all must be knowing. This is the total edge concept, wherein you etch enamel. Total edge, in this total edge systems, what we do is you simultaneously etch enamel and dentine. Okay, so same time for enamel and dentine. If it is 15 seconds, then it is 15 seconds. Okay, whereas in selective etching, you etch the enamel alone separately for 15 seconds. Then either you don't etch the dentine or you can go for a reduced period of time for etching in dentine, because dentine bonding is very close to the pulp. So what can be done is, if suppose etching time of enamel is 15 seconds, you wait for first 10 seconds, then after that you apply your etchant onto the dentine, or even wait for 12 seconds, then you apply the etchant onto the dentine, then you rinse it off simultaneously. Okay, that is, here what happens is, enamel is etched for full 15 seconds, dentine is etched for 3 seconds or even 5 seconds. So chances of pulpal trauma and all is less. That is one type of selective etching. Or you can go in for another system wherein, or you can practice some in a different way that I personally follow, wherein what you do is you etch the dentine enamel for 15 seconds, rinse off that, dry that, then you go for application of an universal bonding system on the dentine as well as enamel. So dentine you can go for, you can use it in a selective etch mode. You can rub it vigorously for 15 or 20 seconds. The simultaneously your enamel also, your bonding agent will go in, universal bonding agent will go in. So enamel, what you are doing is a etch and rinse and universal bonding system, whereas dentine you are doing as self etching in a selective mode. Okay, so that is selective etching. Then self etching, you all know what it is. Self etching, what you do is you apply the etchant onto the dentine surface or enamel surface for 15 or 20 seconds as prescribed. You apply with your applicator. Okay, so how do you select these three systems? For enamel alone, if only enamel is exposed, is involved, like in your direct composite restorations like veneer, or indirect composite restorations like veneer, only enamel may be involved. Then you go for a total edge, or even you can go for an etch and rinse systems. This gives better predictable bond strength. If it involves dentine, you should go for self etch system. Okay, but remember, even though it's faster and easier to apply, your bond strength enamel is reduced, so you have to weigh the pros and cons. If bond strength enamel is compromised, and if you are doubtful about bond strength, you go for a selective etching where you can combine benefits of both. You can go for etch and rinse system on the enamel. On the dentine, you can go for self etching system, that is selective etching. So this is how you select what system needs to be done. The universal bond anywhere we can use. Then we will see a short video how we will skip that. We will go into the clinical tips to improve bonding. 1. Vigorous rubbing application. Vigorous rubbing application means when you are using all these guidelines are basically for some self-etch system, because that is more commonly used nowadays. When you use vigorous rubbing application, you have to apply mechanical pressure to the demineralized dentin surface. Okay, with your rigid applicator. What you see in this picture is a rigid applicator. It's made of stainless steel rather than your plastic applicator tip. You apply mechanical pressure to the demineralized dentin surface with a rigid micro brush applicator with as much pressure as can be manually applied onto the dentin surface. Okay, with the applicator, how much pressure is possible, you apply that. The advantage is it compresses the collapsed collagen matter. When pressure is relieved, what happens is collagen mesh will rebound or it will expand. When it expands, the adhesive solution will be drawn into the collapsed collagen mesh. Moreover, the vigorous rubbing application increases solvent diffusion outward so that the solvent can evaporate. Second technique to improve bond strength is application of multiple adhesive coats. Your sulfate systems bond, the strength of the acid is less. So first layer of the adhesive that is applied will be neutralized by the hydroxyapatite that is present in your enamel and dentin. So you need to apply more acid to increase the etching ability. So additional layers of acidic monomers can be given so that there is better etching. And when you give additional layers, there will be more resin also. So better infiltration into the collagen mesh. So immediate bond strength has been found to be increased with adhesive coatings up to 4 coats. So multiple adhesive coats is very important. Then third tip is delayed light curing. What happens with delayed light curing is that there is better resin penetration. Why better resin penetration? Because the acid component inside the bonding system get more time to demineralize dentin. There will be more depth for the hybrid layer form. There will be better evaporation of solvent. Because of all this, there will be better penetration of the adhesive resin. There will be better bond strength. Then extend the exposure time during light curing. What happens with light is light provides energy for release of free radicals. Okay, so if you give some extra light, there will be more generation of free radicals. There is going to be better polymerization. Then there is going to be slight heating of the bonding agent also when you expose it for more time. This heating will cause the solvent to evaporate. It provides more energy for creation of free radicals. So there is going to be better polymerization. There is going to be high molecular weight cross-linked polymers that are present inside the hybrid layer. So there is going to be better bonds. Then use of a warm air stream. An air stream heated to 60 degrees can be used for solvent evaporation. The same thing, there will be better evaporation of solvent. There will be more energy that is provided to the free radical to generate the free radicals. So there will be better cross-linked polymer material. Protease inhibitors. I told you initial bond strength might deteriorate over time. Why this deterioration happens over time is you have collagen mesh that is fully exposed, all the mineral component has been lost. So it will activate the matrix metalloproteinase that are present inside the dentin. It will degenerate the collagen mesh. Bonding is with the collagen mesh. So if it degenerates, your bond strength also will deteriorate. So you need protease inhibitors. One very effective protease inhibitor is chlorhexidine. in concentration of 2%. So that is why it can be used for rewetting the tooth surface. Okay, so it inhibits the matrix metalloproteinesis, plus it raises the collapsed collagen mesh also. Then other agents like tetracycline and its derivatives like oxycycline, then zinc oxide components containing cements, then specific matrix MMP inhibitors like galardin. All these things have been found to be effective when it is added to the bonding system as a matrix metalloproteinase that reduces the chances of bone degeneration over a period of time. Then another technique is you go for selective etching. Onto the enamel you use your phosphoric acid, no problem. Onto the dentine aspect you go for application of 17% EDTA instead of phosphoric acid. What happens is there will be incomplete demineralization of the uh, inorganic component. So what happens is the collagen will be protected with some mineral content inside the dentine. So that's another technique that can be used to. Plus this EDTA also has some protease inhibiting effect. So these are the techniques that can be used to improve the bone strength. Then seventh is you go for collagen cross-linkers. Collagen is more cross-linked, more will be the durability of the bonding. Synthetic collagen cross-linkers like glutaraldehyde is there. Naturally occurring like proanthocyanidine is there. This can be used. Then manufacturers have also started modifying. So dentine is a wet structure. It's hydrophilic, so you need hydrophilic materials for your dentine bonding agents. Any hydrophobic material is going to fail. So they have substituted photoinitiators with QTX, that is a hydrophilic photoinitiator, or even water soluble photoinitiators such as TPO can be. Then biomimetic remineralization. Bonding agents now come with bioceramic additions or bioactive glass additions. Bioactive glasses are bioceramic materials that has got appetite precipitation effect. So what happens is if there is appetite precipitation inside the collagen meshwork, inside the demineralized dentine, there is going to be better strength for this intermediate hybrid layer. That is, these are the techniques for improving bone strength in dentine bonding. Then there are few recent advances also. Recent advances means first one is futura bond DC. It's claimed to be 8th generation bonding system. Why I stopped with 7th generation is when I discussed about classification, there is no clear-cut definition of what is an 8th generation bonding system in the scientific community. Even though the manufacturers claim so many of their materials are 8th generation, 9th generation, like that. Okay, so this is one material that has been claimed to be an 8th generation. Maybe it's to correct to some extent because the some accepted criteria bonding agents that contains nanofillers is considered to be 8th generation. So here this futura bond DC, it's a dual cure bonding system. It works with like self cure mode or in a dual cure mode. It has got nanosite cross-linking agents made of fused silica particles. Because it is dual cure, it can work in a self-cure mode also without any light. So it's very useful for ENDODONTICS. That is our um, some benefit for us endodontists regarding this futura bond DC. Even without light, it takes only 35 seconds for polymerization. Then it needs only one single bond. That is futura bond. Another material is surpass. Surpass is a universal 8th generation bonding system from Apex Dental, I think. Something remarkable about this is it has got a bond strength of 50 megapascal. Okay, it has got a bond strength of 50 megapascal, whereas all other systems get something around 35, maximum is 35. So it's considered to be a mixture of 4th and 6th generation because it has attributes of both. Surpass comes in a 3-bottle system. It has got an HN separate, it has got a primer, it has got a hydrophobic bonding resin separate. These are in separate containers. That is why it's sometimes considered as a 4th generation. Then it's considered as a 6th generation also because there is no rinsing in between. So it has to be considered as a self-etch system. So Along with this clinical ease of use, another thing is its remarkable bond strength of 50 megapascal. Addis. Addis Vivapen is an universal bonding system. Okay, Addis. Uh, the advantage of this is it comes with a pen-like device. Okay, it comes with a pen-like device because it contains a uh, it has got a switch on top. When you press that, a unit dose will be dispensed into that. Okay, dispensed through the applicator tip onto the surface. It has got a rigid applicator tip also that is made of stainless steel. This applicator tip can be changed after every use. The advantage here is there is no wastage of material. With the whatever material you need, it's going to be dispensed straight away. Okay, so this is a very handy system. There is no evaporation of any solvent before use. There is no wastage of material. They have Vivac then has come up with some other system that is called as tetric N bond also, that also has this kind of applicator or dispensing system. Then self-adhering composite. Self-adhering composite. This is a product by Kerr, wherein they have a flowable material that is vertex flow that contains a bonding system inside that. There is no need for separate bonding. This bonding system works almost like a self-fed system. So there is less chance for post-operative sensitivity. You have reduced steps, so there is going to be, it will save time. So I will wind up with my take-home messages. Message one is almost all the bonding systems that are currently available is dentine bonding systems. So you have to practice wet bonding technique. Message two is be aware of solvent evaporation. If you are using multiple bonding system, if the solvent evaporates, your bonding agent or the primer will not penetrate into the collagen measure. That means there is no effective hybrid layer formation. So don't allow the solvent to evaporate. When you are dispensing the bonding agent, it has to be dispensed. It should not be dispensed much in advance. It has to be dispensed whenever you need. Cap the bottle immediately after application of the bonding agent. Okay, or the solvent will evaporate, your bonding is going to fail. Message 3 is do not rush through the bonding procedure. You should know the bonding system that you are using. Actively rub in the adhesive as advised by the manufacturer. Allow sufficient time for the solvent to evaporate. Give sufficient time for the acidic monomers to work on the substrate, because remember your strength of the acid in self-etching systems are weak. Message 4, properly air dry. Not the etched tooth surface, I mean after application of your bonding agent. Follow the manufacturer's instructions like rubbing, then properly air dry. A single short burst of air may not be enough. You got to air dry with a gentle blast of air till no movement of the resin is visible. In message 5, light cure correctly. Follow the instructions. If your bonding agent is not light cured properly, there is going to be inadequate bond strength. Plus, there will be residual monomers that can leak into the pulp, that can cause postoperative sensitivity as well as pulp and irritation. So, before I wind up, be a lifelong student. The more you learn, the more you earn, and more self-confidence you will have. Thank you all.